So your return on investment for looking at this, for implementing mental health wellness programs, you get about $5.50 per dollar invested, which is a pretty good return. If you look at diagnosing and treating, being aware and changing that, and improving outcomes, you know, you have to sort of invest in all three things. And this is just sort of going after that. You have to implement the whole program. If you just implement a little part of it and leave the rest of it to go, it's not going to happen. So here's just a mental health wellness roadmap, and as I said, you know, these can all be available, so you don't need to write them down. But you know, it's just getting buy-in. Nothing's going to happen if you don't get senior level support in. You need a team champion. You need a team working on these issues, and then you just sort of bop down the stages. So it's not going to happen in 2 months or 3 months. You know, it probably takes a year just to sort of get going and see what is going on in your organization, and then you sort of add things in as you can. If you try to add it in all at once, it's probably going to fail. So here's different things that you can do. Incorporate mental wellness into your wellness plan. I think that's becoming better. You know, it used to be insurance, you could more or less carve out most of mental illness and you could treat the rest, and it's more and more you have to treat the mental illness like you do the rest of the physical health issues. Conduct employee awareness programs. It's okay to bring these things up, and it's okay, you know, we have resources available not only to treat your heart issues, we know where to refer you to that, but we know where to refer you. We either have an EAP program or we have our behavioral health partners that will get you help if you need it. You don't have to take that, but here's suggestions for you. You can bring in mental wellness seminars, how to deal with stress, reaching resiliency, educate your managers about mental health disorders. You know, we talked to a small group when Tanya brought some folks out to our office and talked to a small group about mental health and wellness. And there's a wide variety of education and training and what people bring to the table regarding their thoughts about mental health, behavioral health, and also how they sort of view it, the prism, their glasses that they view it through. You know, so you have to sort of take somebody where they are, an organization where it is, and then go stepwise from there. Not every organization is not the same. There's a lot of things that are available now. I know it's very difficult for a lot of people to get to offices, to take time. They have a lot of things going on with the family. So there's things like on-site telehealth services. We ourselves have a telehealth network, and we go to multiple sites throughout Nebraska, Iowa, South Dakota, and are growing that. You can bring that straight to employees' homes. You can bring it into the workplace, so you can have a kiosk. We couldn't get this guy hooked up with the internet, but this is actually a little robot, and he can just be driven off-site by a computer or by a smartphone and things, and you can drive him around, and you can look from the camera on your phone or iPad, and you can look at the person and you can talk to them. It's also a way, actually, employees can go to work this way, kids can go to school this way, so kids with cancer, they're able to go to school. He has little things where he can get to be 5 feet tall, but they made him small, so when he goes in schools, he's not seen as threatening. Because when they put the 1-foot extensions on him and they took him down a road, people perceived it as threatening. So the shape of this right here actually is sort of resemble a human form of a face. So, and then the little guy down here that he travels on, that's actually the iRobot technology that runs the little sweepers around your houses and stuff. So, and they're developing those types of things in hospitals that have a lot of peripheral things like stethoscopes on them, ENT instruments. So a lot of things can be done with the docs and nurse practitioners, nurses even at a distance, so you don't have to have it all on site. So education and acceptance is the key. Sample education and awareness ideas And these are all available. These are just some things. A newsletter campaign, have it in the newsletter, company newsletter. Breakfast or luncheons where people present or have things on webinars, social media type of campaigns. So there's a lot of different things you do. They don't have to be costly or big things to get people, handing out stress balls and talking about stress. Just little things like that, You can do a health promotion where you have these little Fitbit guys and you see who can score the most minutes of walking or things like that. That's if you remember where you put your plug in so you can recharge it. So have a mental health champion and screening tools. There's if you have employees who are stressed, it might be that there's little screening tools. One is called the patient health questionnaire. It's just 9 questions talking about depression. They can do that, and it doesn't even have to, they can do that and just maybe send it off to a behavioral health provider, and the organization doesn't even get a look at that. But it allows them maybe to get some feedback. Is it something that they might need some help with? So the earlier you can detect things, assess them, diagnose them, and treat them, the better off for the whole organization. When you let these things simmer, that's where you get problems with employees getting mad, sort of infecting the environment, or getting mad and coming back and doing things, posting things, all things of that nature. So the different types of mental health providers are out there: psychiatrists, primary care providers, psychologists, various ones. It really doesn't matter where they start, it's just starting them somewhere. Because once they get to that point of contact, the system is often pretty good at sort of moving them along. So a licensed mental health practitioner is usually a master's level therapist who's got their bachelor's and has their master's in counseling, and has gone and taken a test and has done hours under somebody to usually around 1,500 hours they have to do or so to become a licensed mental health professional. If they're a licensed independent mental health professional, they don't have to be under somebody. They can be doing some of that on their own. A psychologist has gone through college, and they go through a specific psychology program that's 3 years long, and then they go on and they do a postdoc and they do some extra training, and then after that they have to do another year where they're under a psychologist and they do testing, they do all the psychological testing, and they do counseling. But in most states they do not prescribe medication. If they would prescribe medication in those states, they have to go through additional training where they take training on medications. And then a psychiatrist, which I am, college, and then you go to medical school. And then for me, I went through 5 years. I went through 3 years of adult training and 2 years of child training, and in a residency program, and then I got out. So when kids ask me, they say, well, I want to be a psychiatrist. I say, well, that's great. That's okay. You do your 12 years getting through high school, and then you get to go repeat it all again.